Doctors Management works with healthcare providers and institutions throughout the United States, and we've observed several significant trends in recent years. Hospitals are in the midst of merging and acquiring other facilities to create powerful health system networks in their local communities. As they do that, they're on the prowl to buy up and secure affiliations from primary care and specialist providers. Their goal is to ensure that they can offer the breadth and depth of medical services necessary to be competitive in their market. At the same time, private practices are looking around for potential merger partners in hopes of reaping economies of scale and negotiating more favorable managed care contracts. But what does all this merger and acquisition activity mean for you? At a time when you're likely frustrated by declining reimbursement, rising practice expenses, more restrictions on what and how you're paid for your patient care services, other providers may in fact be looking at you and preparing to make you an offer. And the value of your practice may never be higher than it is right now. Your practice has significant value in its assets, in your standing in the community, the ancillary services that you offer, even your well-trained staff. But how do you know the value of what you've created? My colleague, Blake King, CPA and Certified Valuation Analyst, will explain.
Once you start to consider selling your practice, one of the first steps should be evaluation. Medical practices are not like cars. There's no blue book where you can just go and look up a particular specialty and it tells you what the value should be. Like most small businesses, the value of a medical practice is more ambiguous. It takes a good deal of analysis to estimate. Our goal is to give you an opinion of value as it should be used for your negotiations, whether they be with a hospital, a new partner, or some other acquirer. To do this, we use techniques that are recommended by the leading experts in healthcare valuations and the National Association of Certified Valuation Analysts. We are committed to helping you through this process step by step and want for you to understand what will be happening. When most physicians begin to debate selling their practice, their first stop is their local CPA. The problem is, most local CPAs are just not familiar enough with medical practices or the particular techniques that they require to perform a reasonable valuation. We are constantly training and staying up to date on the many laws and regulations that affect medical practices. Also, many local CPA firms miss the fact that some practices have intangible value aside from goodwill. Missing those intangibles can potentially cost you a great deal of money. Once the valuation is complete, you will be presented with an extensive 40 to 50 page report which details all of the calculations. The report will read like a story, explaining step by step how the value of your practice was derived. The entire process takes about 4 to 6 weeks once we have the information in hand. In the end, your practice is only worth what someone will pay for it, but a valuation should give you a good starting point for the negotiations. Of course, the valuation will be held in complete confidence and will only be shared with those to whom you direct. Now, Charles Robinette, JD and Senior Management Consultant, will explain more about how Doctors Management can partner with you to help you realize the potential value of your practice.
Thank you, Blake. Obviously, there's much more to the evaluation process than the financial evaluation of your practice. The second phase of our process is an examination of the intangible issues that are important to you and your partners. Before we can have the first conversation with a potential acquirer, employer, or merger partner, we need to understand the wants and needs of you and your partners, individually and collectively. A very clear understanding of what you want to accomplish is essential. You probably have a loyal staff that's been with you a long time, and your plans for your staff and future staffing considerations need to be articulated. The quality and level of care for your patients post-merger is a significant concern as well. When our due diligence with your practice is complete, we replicate the process with all potential acquirers. The third stage of the Doctors Management process is an assessment of the strengths, weaknesses, and relative market position of potential acquirers or merger partners. Their financial strength, liquidity, profitability, debt level, and general reputation in the community are issues that impact yours and your family's financial future. However, your acquirer or merger partner must have a management philosophy and style that's a fit for you, your partners, your staff, and your patients. The financial implications of a merger or sale are important, but compatibility issues must be resolved. The doctor's management process requires that we satisfy our professional standards by thorough preparation, due diligence, and continual communication with you at each stage of the evaluation and negotiation. We will not represent you as an attorney or CPA. Our agreement with you will be in the form of an agency agreement. However, we will work closely with all your advisors to obtain the results you deserve. Now, Valora Gorganius, MBA, will have some concluding remarks.
Doctors Management can establish a value for your practice, help you negotiate a competitive compensation and bonus package with your potential partner, hammer out terms to ensure that you'll be able to provide the same or better quality of care to your patients than you were trained to deliver, and help guide you through the ownership transition. We advise over 400 clients throughout the country on practice management, valuation, coding, billing and collections, marketing, accounting, and consolidations. Our team consists of MBAs, JDs, CPAs, and certified valuation analysts who are expert in contract negotiation and transition management. With Doctors Management as your advocate, you can leave the business of medicine to us. Send us an email now by clicking on the Ask the Consultant link on our website, or better yet, give us a call at our toll-free number for a complimentary telephone consultation to discuss options for your practice and your career. Thank you for listening.